What's up, HASfit Tribe? It's your personal trainer, Coach Kozak.
And I'm Claudia. Today's focus is going to be on sciatica pain relief exercises and treatment.
This therapy session works to free your sciatic nerve, improve mobility, decrease inflammation, and strengthen the surrounding areas.
For this routine, you will need a chair.
You may also want to have a towel or a band available to you depending on your flexibility level.
If you're ready to begin, let's get started.
Let's begin today's session with a seated floss. So this is the one you're going to need your chair for. Nice sturdy chair will do you. Usually you don't want something too soft like a couch recliner. If you have a dining room chair or something hard, usually going to work a little better for this one. We want to scoot to the front of our chair and have really good posture. Now let's place our hands on our hips. And I'm going to simultaneously bring my right foot back and bring my chin to my chest. Now I'm going to bring my chin up to the ceiling as I extend my right straight leg. We're going to slowly repeat this 10 times on each side. All right, ready and begin. Chin to the chest, right foot back. Now slowly chin up and extend the leg out straight. Repeat. Again, it's just slow. You want to be really patient with this one. And so this is called we're called nerve flossing here. And so we are literally taking that sciatic nerve that gets stuck, if you will, gets pinched. That's that pain you feel. And we are gently pulling it back and forth, trying to free it. It could be stuck from inflammation. It could be stuck from lack of cushion between your vertebrae. Breathing through while you're doing this one. Again, it's 10 repetitions in total.
This one is number 8. 2 more to go on the right side.
And we don't have to get that foot up too high. Just extend that leg straight.
And last one right here. Exhale.
And relax. Okay. We're going to perform the same move on the opposite side. And begin. Left foot comes back, chin to the chest. And then extend as we bring that chin up. Really got to have patience with this one. This is a great move to start your day, and you can do up to 10 repetitions on each side every single day, but we don't want to overdo it. Again, we are almost playing with that nerve, bringing it back and forth, so this isn't like a muscle that you can work and just keep working until it gets sore. We don't want to overstimulate that nerve or overwork it where we're going to create more pain. We're just trying to free it here.
2 more to go.
And as I said, this exercise you can do every single day, 10 times on each side.
Last one right here, number 10.
All right, very good. We're going to come up gently. We're going to set our chair to the side, and we're going to move to the floor for the next several exercises. Recommend you come down on your knees first, and then we're going to move into a prone position, so out onto your hands, lying down on your stomach. Why don't you place your 2 fists down on the floor, and we're going to get into a prone position with your forehead down on those fists. Now, Claudia's going to stay there, but I'm going to try to come up onto my forearms and do a prone cobra, and I'm going to hold. Now, depending on which position you feel more relief and more comfort, if you feel more comfort here, stay here. If you feel more comfort here and relief here, then I want you to come up. Everybody's different. And we're going to hold this position for 30 seconds in total.
And would you like our feet to be flexed, right? Correct? With our toes pointed down?
Yes, please.
Okay.
A slight contraction of your glutes. It'll kind of take the pressure off your back. Again, you decide which one of these positions you feel more comfort in today.
Remembering to breathe throughout the whole exercise. Do not hold your breath.
For 5, 4, 3, 2, 1, 0. All right, we're going to relax and we're going to come up onto our hands into a quadruped position on all fours, on our hands and our knees. Next, we're going to perform what's called a bird dog. Great exercise for our whole posterior chain. I'm going to take my right hand, bring it to my left knee, and then extend my right arm and left leg back down to the floor. Now, left hand goes to my right knee, extend back down to the floor. We're going to perform this one for 10 repetitions on each side, so 20 in total. Ready? Begin. Right hand, left knee, extend, back down. Again, everything today is done with deliberate motion, not rushing anything. I want you to keep your core braced, your shoulders stay square to the floor. We're not rotating in either direction. When you bring that arm up, I want you to contract those upper back muscles. And when you kick that leg back, I want you to kick back with your heel, almost like you're trying to kick a hole in the wall behind you. So you're not bringing the leg up like you're trying to kick the ceiling, but instead like you're trying to kick straight back through that heel.
I think the main thing too is just to focus on keeping both your shoulders and your hips square throughout the whole movement. So no rotation.
That's a great point.
Almost like you're trying to keep a nice tabletop back.
That's it. Get a balance of water glass on your back throughout the whole exercise and it wouldn't fall. That's the goal.
Here's number 14, so a few more to go.
Again, deliberate and controlled movement here. Working on our core strength, glute strength, back strength, as well as another exercise is just going to help free that sciatic nerve.
We have one more to go. Last one right here.
Straighten it out and relax. Okay, we're going to come over to our back side now. We're going to hang out there for a little while. So come on down, lying down, flat on our backs. I want you to have your left foot up and your right leg out straight. We're going to perform a straight leg hamstring stretch. With that right straight leg, we're going to bring it straight up and return it back to the floor. Now, depending on your flexibility level, you may only be able to get it yay high, or you may be able to get it much higher. You can also use a band or a towel to wrap around that foot, a long band or a long towel, to help you pull that leg up if you find it helpful. We're going to do 30 seconds on each side. Ready? And begin. Now we call this a straight leg hamstring stretch because we want to keep the leg straight. That means no bend in the knee. So basically you want to get it as high as you can while keeping that leg straight without knee bend.
Not much time left. In 3, 2,
1, and switch.
All right. So same move, opposite side now. So I'm gonna set my right foot down on the floor. Left leg goes out straight. Lower back is glued to the floor. And begin. Left straight leg up and down under control. Control it on the way down. Don't just allow that leg to flop back down. And again, we're doing our best here to free that nerve wherever it may be pinched.
Exhale as you bring the leg up. Inhale as you bring it down. Not much time left. In 3, 2, 1, and break.
All right, next up, we're gonna work to increase the mobility in our hips. This next one is called a Faber stretch. It's an external rotation. Let's place that left leg down straight. And I'm gonna bring my right leg up. If you can, if you have the flexibility to do so, bring that right foot up by your knee. If your flexibility isn't there, you can keep it down closer to the shin. Then we're gonna allow those hips to just open up and let gravity do its work here as you feel that hip open up. So you may feel some tightness here. Again, it is a stretch. We're gonna stretch here for 30 seconds and begin. Just big, deep breaths. And as this 30 seconds goes by, try your best to just allow it to open up a little more over time. And many of you will notice that one side may be much tighter than the other.
Definitely. You might also have a problem side. For me, my right sciatica always pinches, hardly ever my left. In 5, 4, 3, 2, 1, and relax.
Okay, so as I'm sure you've guessed, let's do the same move, opposite side. Bring that left leg up, that left foot up. You know, our day-to-day lifestyles, you know, now are just not great for our hips and our back. Just so much time sitting, it's just so unnatural. I mean, I'm guilty of it myself. But that's why we need to take this time to restore the mobility and strength in those areas.
That's why these are our most popular videos.
They are, and they've proven to be successful over the years, and we're so grateful y'all have trusted us when, you know, in your time of need.
Absolutely. Thank you so much. Not much left. In 5, 4, 3, 2, 1, and break.
Okay, so that was an external rotation. Now we're going to do an internal rotation. So let's bring both feet up, firmly planted on the floor. I'm going to bring my left foot up now onto that right knee. If you need to, you can use your hands to get it up there. Now, I'm going to allow my right knee to drop down. Go ahead and scoot that right foot out as you do so, and then apply downward, gentle downward pressure with that left foot. So you're bringing that knee to the floor, gentle, and then it's just another static stretch. We're just holding. So you can see that last stretch, the external rotation opened it up, and this is internally rotating it. Again, just another hold. This one is 30 seconds in total.
5, 4, 3, 2, 1, and slowly bring that right leg up.
All right, now again, both feet firmly planted on the floor, and this time let's bring our right foot up. Again, if you need to, use your hands to get that right foot up by the left knee. And now allow that left knee to drop to the floor as we scoot that left foot up or out. And we apply gentle downward pressure using our right foot. Again, you may not be quite as flexible as we are. You might be up here, and that's totally all right. Or you may be much more flexible than us and bringing that knee all the way to the floor. But make this work for you as you internally rotate those hips.
We don't have much left on this one. In 5, 4, 3, 2, 1, and bring that left knee back up.
All right, next up, we're gonna focus on our core strength, specifically those deep inner ab muscles with what's called a curl up. So for this one, let's keep that left foot planted on the floor. Our right leg is going to extend out straight in front of us. We're going to take our hands, and if you have the flexibility to do so, place them underneath the small of your back. But if your shoulder flexibility doesn't allow you to, you can just place them right on your hips. So now I want to create downward pressure on my hands. So I should feel my back and my hands. Shouldn't have some arch where you feel space between your hands and your lower back. This one's a little different because we're going to do 10 sets of 3 seconds. So I'm going to bring my straight back up, keeping a neutral spine, straight up, hold for 1, 2, 3, and then you're going to come back down. So you only want to bring your head up minimally. We're bringing those shoulder blades up, contracting our core for 3 seconds, and then going back down. Ready? And begin. So again, the shoulder blades come up, squeeze those abs, 2, 3, back down, 3-second contraction, and again, 1, 2, 3, back down. So if you're feeling tension in your neck, up, bring that tongue to the roof of your mouth. It could also help. And back down. Again, also, that head is only coming up minimally. Bring those shoulder blades up. Again, up, 1, 2, 3, down. Last one on this side. And 1, 2, 3, relax. All right, now let's switch our feet. So our right leg is going to come up with that right foot planted firmly on the floor. Left straight, leg is out, and we're going to continue. Ready, and begin.
Exhale as you bring your head up.
3-second contraction and back down. Now, if you're strong in your core and this is too easy for you, and up, feel free to increase that time under tension all the way up to a 30-second continuous hold. Down. And again, feel that core tighten. Breathing through the core. Back down. 2 more. Up. Squeeze, contract, contract, contract. Back down. Here we go. Last one for 3 seconds. And up. Shoulder blades off. Minimally bringing your head up. And relax. Back down. Excellent. Okay, so for our next one, we are going to turn over onto our side and perform a side lying clam. So on our left side, I'm going to place my left arm out straight at my side. My feet are together. My knees are bent at about a 90-degree angle. I'm going to relax my head on this one. If it's on the floor, that's cool. But I'm not here in a flex position. Placing my right hand on my hip. Now, keeping my feet together, I'm going to open my hips up and squeeze my glute right here, and then return back down. We're going to do this one for 12 repetitions in total. Ready, and begin. Open those hips up. And you can see how Claudia has taken her hand and placed it behind her head. If that's a more comfortable position for you, feel free to do so. Again, we're working our lower body on this one, so whatever it takes to feel comfortable up top.
And you want to exhale as you bring that knee up.
Get a nice full contraction up at the top. Squeezing that glute.
Keeping those hips nice and square. If you feel like you have to rotate your whole pelvis, then you're going a little too far. So go just about where you feel most comfortable and able to keep that nice square position.
This one's working to build strength in our glutes, which anytime we can have stronger glutes, it takes the pressure off our back and our spine. And it's the muscles that are doing the work as we move, opposed to our spine, bones, and joints.
That's number 10. We have 2 more.
All right, last one. Excellent. All right, let's turn over onto the other side now. same move. We're doing a whole flip here, but you might not have to flip quite as much as we do on this
You
one.
might just have to roll over.
Yeah, exactly. Again, same move, 12 more repetitions. Ready and begin. Opening those hips up and closing them. Every time getting a nice squeeze of your glutes, your backside. And of course, today, the intent of today's routine is to help with that sciatica pain relief. But hey, if we get a little tighter glutes in the process, we'll just call that.
Yeah, that's never a bad thing.
We'll call that an added bonus. Again, with all the exercises today, this one included, we're not rushing on this. All very deliberate movements as we work both our glutes as well as getting some inner thigh work as well on this one.
That's number 9. 3 more to go.
Controlling the way down as well, not just the way up.
And last one. Very nice.
All right, so let's come on up onto our knees for our last movement of the day. It's called a kneeling hip flexor stretch. So we're going to be on one knee for this one. We're going to work to improve the mobility in our in our hip flexors as well as our quadriceps. We're going to place our hands on our hips, and I want you to tighten and contract your abdominal muscles as well as your glutes. So poke them. Are they both tight? They should be tight. All right, if they're tight, now we can slowly and carefully come forward, and we should start to feel that stretch down from the hip flexor all the way down to the knee there throughout the quadricep. And it doesn't take a lot of range of motion on this. It's a 30-second stretch. We're just going to hold it while continuing to contract our abs as well as our glutes. So if you can come way forward with this, I would question whether or not you have your glutes and your abs contracted or squeezed. Again, just another 30-second hold.
Breathe through that contraction.
Good posture throughout. Shoulders are back. Not much left on this one. For 5, 4, 3, 2, 1. All right, same move, opposite side now.
Ooh.
Right knee up. Again, squeezing those glutes again, squeezing those abs, and then we gently come forward. And we're just holding another static stretch here. So oftentimes when our hip flexors are tight, it causes us to have that pelvic tilt syndrome where we're coming forward. Those hip flexors bring us tight, and then it's stretching our back, and it's stretching that sciatic nerve, causing inflammation, and it's just this compounding problem. So as you can see today, there are so many different causes of sciatic nerve pain, and we're addressing it from every single possible angle.
That's right. I'm going to get that nerve loose. That's what we're working on.
For 3, 2, 1, 0. And that's it. We made it. You made it through today's routine. Now, here's the time of the session where I need to be honest with you. This is not a one and done type of therapy session. This is a typical physical therapy session. Physical therapy work is 3 times per week for 12 to 16 weeks. Now, I know that's not what you wanted to hear. You wanted to hear I did the one video and I'm cured.
And I feel good.
Right. But so many people, even after the pain goes away, we really need to keep this up over time so that it doesn't come back.
That's right.
That's what we recommend to you, because if you know our hearts, it's that we want your pain to go away. We understand how hard this can make life and
debilitating. Your quality of life.
It's all consuming. Mm-hmm. So again, I'm going to repeat that to you. I'm not trying to tickle your ears and tell you what you want to hear. I'm telling you what you need to hear, right? Which is 3 times a week for at least the next 12 to 16 weeks. And then you can keep it up after the pain goes away at a maintenance level, maybe 1 to 2 times per week after that, to make sure it never comes back.
That's right.
Okay, so my speech is done. Thank you so much.
We appreciate it.
Thank you so much for joining us today. Did you know you can get faster results by following complete exercise programs? And we put all that together for you. Where?
On the HASfit app, which you can download to your Android or Apple device.
You can also stop by our store, support us by picking up some HASfit gear, like a fresh new t-shirt or our diet guide, Eating for Life.
Don't forget to like us on your favorite social media channel.
Until next time, I'm Coach Kozak.
And I'm Claudia.
And we will see you at your next workout.